Hello, our esteemed audience. Welcome to another episode of AI in Healthcare series. I'm your host, Dr. Harshita Gupta, and it's truly a pleasure to have you all with us today. For those who have been with us from the start, you know we have explored a multitude of topics delving deep into the intersection of artificial intelligence and healthcare. Each episode has been a treasure trove of knowledge featuring insights from experts in the field, and today promises nothing less. Before we immerse ourselves in today's discussion, I want to extend my gratitude to two distinguished guests who have played a vital role in the success of this series. For our returning audience, these names need no introduction. And for those joining us for the first time, allow me to introduce two brilliant minds in the healthcare who are joining me once again, Dr. Dipu and Dr. Amit. Dr. Amit Day stands as a distinguished physician and diabetologist. Beyond his reputation as a leading expert in the medical field, Dr. Amit is also a visionary AI entrepreneur. His unwavering dedication to advancing healthcare innovation through AI serves as a true inspiration to us all. And we are honored to have Dr. Dipu Patel, a digital health consultant, with us today. Dr. Deepu's expertise lies in her unique blend of clinical insights and a profound understanding of technology's role in enhancing patient education and advocacy. Her belief that even as technology and education evolve, the human touch in healthcare remains irreplaceable. Together, Dr. Amit and Dr. Deepu bring a wealth of knowledge and experience that will undoubtedly enrich our conversation today. Without any further ado, let's dive into the fascinating world of AI in healthcare, a year in review with our esteemed guests. Welcome, Dr. Deepu and Dr. Amit.
Thank you very much, Harshita. I really appreciate the kind introduction and Happy New Year to our audience.
Yeah, I think there's some connection issue.
I think, yeah, Amit is a little frozen. I'll take it from there.
Yeah.
Do we want to dive into the first question?
Yes, yes. So, Dr. Deepu, in the rapidly evolving healthcare landscape of AI in healthcare, what do you consider to be the most significant technological breakthroughs over the past years? And how have these advancements impacted patient care and outcomes?
Yeah, that's a very meaty question and a great one to start this discussion and dialogue with. Well, I think needless to say, and I think a lot of our audiences who follow the AI landscape, and I think Amit would agree, is 2023 was a landmark year for artificial intelligence, specifically generative AI. It really became the mainstay of the use of how AI can be applied in our daily lives, not only for patient care, but in our daily lives, quite literally, everything from looking up recipes of what to make for dinner to in our world of healthcare, how to provide patients with the best education at their level. So I would say that AI, and specifically generative AI, had a wonderful year. And I'm actually very excited to see what 2024 brings, because I think we have not even scratched the surface of what this piece of technology can do for us. And of course, I will just, I'll let Amit take it from here, but I will say with everything that's good, we do always have to balance the risks that come along with the benefits of any piece of technology. We can certainly talk about that a little bit later on, but we'll start there. So Amit, your thoughts?
Yes, completely echo with what you said. Generative AI has been the landmark in the domain of AI. But if I have to pick one particular thing that has evolved and that is going to set a further distinguished milestone in 2024 is the evolution of fine-tuned large language models. I think that is something that has been a game changer in all domains, and especially in the field of healthcare. We have evolved from a medium language model to a language model that is trained on a larger data set of parameters, and that too, things which can give you good outputs with added layers to minimize hallucinations. I think that has been a very good breakthrough in the later half of 2023. When we started exploring AI in the end of 2022, we were also fascinated about generative AI. And from 2022 November to I think 2023 November or December, we reached a point where we could actually have multimodal generative AI. So I think that was again another milestone being achieved from a simple text to speech or a text to audio conversion. Now you have multimodal generative AI where any form of text, speech, audio, or video can get converted into any other form of text, speech, audio, or video. So that multimodal conversion has been another milestone achieved in the field of generative AI. But if I mark one most important achievement, it's the development of the large language model. And in the domain of healthcare, this is there to make big change in the days to come.
Absolutely. I would completely agree. And I think, what has allowed us to kind of really harness large language models, which by the way, has again, another term that we didn't even know the term, until late 2022 or early 2023, is natural language processing. That really has become the foundation upon which these large language models are built and then utilized for lay people, right? Like us. Like I am not a formally trained artificial intelligence scientist or computer scientist, but the fact that it is so approachable and allows me to use it with such ease is what makes this piece of technology and this tool that we now have in our toolbox as healthcare providers to really put our best foot forward for our patients. And in fact, I think in the next, I would say 3 to 5 years, our patients are going to demand that we use this tool in our practice.
Yeah, thank you for that insightful overview. Moving ahead, the application of AI in healthcare isn't uniform worldwide. So, could you share insights into how AI in healthcare has evolved differently across various regions, and what lessons can we draw from these diverse applications?
Amit, do you want to take that one first?
Yeah, I would love to take that. I think I always find a silver lining in this diversity. I think AI is just another step kind of making globalization a much more realistic to a great extent. While there is going to be diverse use cases, applications, adaptability, regulations of various AI tools, if I can be specific with generative AI tools, there is greater collaboration I can see. Something is what's happening right now, a fantastic collaboration between Dr. Dipu and myself and our MedSynapse team. We collaborated so beautifully to take AI literacy across our global audience. And just through this podcast itself, we are connected with so many people globally. So I really see a stronger globalization happening. There would be places where a model would be very specific to the need of a specific region. But in most scenarios, you're going to find a larger use case models which can be applied globally in different sectors. And that would definitely be the base work being done, and based on which fine-tuned, refined regional models or regional guided models based on regulations and guidelines of that specific region can be developed, and it can go on to happen. In terms of the adaptability, I think we are still not in that phase where we can say that it has been adapted very well, because I think we are still a long way to go. But the curiosity is there. The curiosity is there in both the AI service provider and the AI service user.
Yeah.
And I think that is a very important curiosity. The ones creating the AI tools are very curious, and the ones using it or intending to use it are equally curious about the literacy part of it and how we can use it to the best use case in my practice, in the domain of healthcare, in my clinical practice. It's just taking us one step ahead. Dipu, your thoughts?
Yeah, no, I completely agree. I think I see this as another inflection point in the arc of technology. What the internet was for us, however many decades ago, this is now another inflection point in that arc. And um, much like access to care and access to connectivity, this is going to become one of those, I guess, digital social determinants of health, I guess, because it's going to be as important to have access to this technology as it is to have housing and transportation and all of these other things that we look for from a patient lens, but also a provider lens and a societal and cultural lens. And so I think I echo a lot of what Amit has just said, and I really think that we haven't started on the upswing yet. I think that curiosity is still very much there. There is still a little bit of fear. There is a little bit of fear in certain sectors, but I think that's going to be mitigated as they learn more about how this tool, and it very much is a tool. I do want to emphasize that our jobs aren't going to be taken away. The robots aren't going to take over the world. It is a tool that we're going to have now to really improve access to care, improve the care that we provide, improve outcomes. And yes, it will come with shifts in how we provide care. It'll come with shifts in various industries in terms of workforce transformation, but it really is going to, I would say, I'm optimistic about what it can do. And how we're going to be able to harness and leverage this technology for the betterment of humanity, I think.
Yeah, and it's evident that we can draw valuable lessons from these diverse applications. Now, moving ahead, ethics is a critical aspect. Dr. Amit and Dr. Dipu, in the past year, how have ethical considerations surrounding AI in healthcare, such as patient privacy, data security, and algorithm bias, has been addressed or challenged?
I can start here. I mean, it's first of all, I don't know if they've been addressed. Let's just start there. What we are noticing is that we are highlighting the challenges of algorithm development, of patient privacy and security and biases in the algorithms. How we are tackling this is still very new and fresh from an engineering standpoint, because building these algorithms, they're done by humans. We all have our biases, conscious, unconscious, whatever they may be. And really teaching the bias out of an algorithm is going to take time. And so the first step is really identifying the fact that there is bias in the system and in the algorithms. And then the second step is really working towards building human-centric, unbiased algorithms that provide us the best data available for the patient, the human in front of us. And again, I think we're still in the challenges phase of this. I don't think we have perfected the AI space when it comes to ethics. We're definitely going to be struggling and be confronted with the challenges of all of this over, I will say, the next even decade, because it's going to shift as we learn more and more.
Totally agree there. And 2023 had been the year where most of us had been swept off with this magnificent technology coming to us. We didn't really get much time to sort of think about the ethical considerations, although some of us made a lot of noise that yes, there could be ethical issues and challenges and guidelines are required and regulations are required. Still, nobody has that answer, and I completely agree with Deepu there. I think 2024 is going to be a very crucial year for that. Now, when you talk about ethics and the accuracy, we should also talk a little bit about the accuracy of these large language models. I think one thing which is actually developed, and if you look at the development of a model like a chat GPT, if I can give an example, because if you still argue with most of our colleagues would say that yes, chat GPT is way above the others in terms of its development and the user acceptability as a large language model, if you compare that with the Google LLMs or any other LLMs that stands at the moment, which is available on open access, or also any other open access platform or the proprietary ones. So if you look at the track of ChatGPT, one thing that they have successfully done is minimizing the hallucinations. And I think that has been a big achievement in taking away some of the bias, some of the ethical consideration, some of the things which could be a big limitations of a large language models. But it's not even half the job done, because the ethical issues, the regulations and the guidelines will have to be addressed in 2024. Now, as and more you see use cases of a model like a chat GPT into healthcare, you have to be understanding this very clearly. You're dealing with patients' private data that you're putting on an open source platform, and you're allowing the platform to learn and develop, and you have no clue how that is being used also in the later stage. So all these questions are still in the dark zone, and these questions will need to be answered. The guidelines and the regulations will have to be mapped regionally. And this, I keep saying everywhere I speak about this point, that while there can be a generalized global guideline, while which can be a very much a proprietor guideline. I mean, ChatGPT can create their own guideline, Google can create their own guideline. They can create the barrier as to what is right and what is wrong. And it can be sort of the ethical barrier created by a proprietorship company, while that particular company's large language model is being applied to a country like USA, the EU, or a country like India, the government of that particular country has to come in collaboration, which usually happens whenever they're running on the other platforms like the Facebook and the Meta, and the way they do it, it's similar. The country's guidelines will have to be overlapped with that, and thereafter that user access and the how much of the LLMs will be accessible for that particular country, and all those things are going to be coming in that way. And I think that is going to be very crucial to the acceptability and the success of that LLM in that particular region. Because if you bind it too hard, it might not get a florid user acceptance. At the same time, if you let it flow freely without any bindings and guidelines, then you are bound to face some consequences, especially in the domain of healthcare. So a lot of those questions remain to be answered. 2024 will be a very crucial year for that.
Absolutely. I agree. I think, at least from a US point of view, a lot of the policies and regulations are still lagging behind and are still in the exploratory phase of what is it? What do we want to do with it? What guardrails do we want to put around this? And I completely agree with Amit about the regional aspect of it. It's going to vary state by state. It's going to vary region by region in the US, depending on what the applicability of that model is going to be. So stay tuned. Lots of movement to come in at least this year.
Definitely.
Yeah, and let's now move ahead. So how has COVID-19 pandemic continued to influence the development and application of AI in healthcare, particularly in areas like disease tracking and vaccine distribution?
I think it's been immensely impactful. Go ahead, Amit. I interrupted you. Go ahead.
Okay, so I would say one very simple thing, and I keep believing that the way we were prepared to face a pandemic in 2019, we would probably be in a better place to face a pandemic with the use of AI and predictive analytics coming in. But having said that, the larger role of AI will be in the remote monitoring, and yes, to some extent, to a greater extent, in shaping up the epidemiology of a disease, and also in drug trials. We will see that coming in. But whenever we talk about these things gonna happen, don't expect something outstanding to happen in a short phase of time, because these are going to happen over a larger section of a time. But my crux is, if you look at a pandemic that the whole world faced, a crisis, COVID-19, God forbid, if that happens again, we would probably be a little better placed. One, of course, because we have learned from our experience in the past. And the second, because we would have tool of artificial intelligence there to aid in majority of the things which can be used in a crisis situations like a pandemic. Dipu's thoughts?
I echo that. I think we are, the COVID-19 pandemic really did impact or has impacted how we now put in some measures around response time and responses. And I think that AI has been most or will be most impactful for the next pandemic, because it's not a matter of if, it's a matter of when it comes to pandemics. Is that, yes, I think we'll be better prepared, although we're not out of the woods out of this one yet either, right? We're
Yes.
only a few years out from actually being fully into it, but we're still on the lagging phases of the pandemic, and we're seeing spurts here and there. And really what's happening is the epidemiological data. The data is what's helping us drive a lot of our decision making and resource allocations and all of these things that we need for decision making in terms of how do we track the disease? Where are the most vaccines needed? Where is there an outbreak, and how can we address it fastest, right? And so I think big data, predictive analytics, all of these things that are aspects and fall under the umbrella of AI are really going to impact what we do in terms of planning for the next one. I agree. I don't think we're fully prepared for the next one. I think we're better prepared, but that's because we have better data. And I will say that I'm very optimistic about the area of vaccine development, not only through the lens of pandemic and COVID-19, but vaccine development as a whole, because we are going to see how AI is going to impact the biotech industry in terms of decreasing the timeline of the pipeline of the development of vaccines and drugs. And so that is an area that I'm really excited to see how it develops over the next 3 to 5 years.
I'll just add one point here, Deepu, that it's just not about vaccines, but the whole phenomena of drug developments. Yes, I think that is going to really get upscaled. There's going to be a lot of quick developments coming in, and the results that clinicians like us are going to see is that quick drug discovery, quick drug trials, the phase 1, phase 2, phase 3 trials are going to happen very fast. I would
And
really
precision.
follow precision, with a lot of individualization coming in. And one such example, if I have to give it to our viewers, is closely follow the developments which are undergoing in AlphaFold. And I think it's very promising in terms of drug development. And it is just a matter of time that more and more pharmaceutical industries are going to use AI technologies in their drug development process. It's already underway. I know some friends who are already using it, and it's just going to be used in a flared up way.
Yeah, and again, I do want to emphasize that the promise of precision and personalized medicine is going to come to fruition very quickly within the next decade, for sure, I would say.
Yeah, definitely AI is driving force behind this transformative shifts. And now, considering the ongoing pandemic, what role has AI played in growth of digital health and telemedicine over the past year?
So that's totally my jam in terms of the question. So digital health, I think it has really expanded the access and the visibility of the ability of technology to provide care no matter your geographic location. I will just say that, again, policy and regulations are the things that kind of lag behind around this, but it's not the technology that's holding us back. And so digital health technologies have really helped improve patient access to care and improve patient monitoring through remote patient monitoring, through various wearable devices, through making EHRs much more accessible to healthcare providers. And so what we thought was not possible just prior to the pandemic has laid bare and said, yes, it is possible and we can do it. And up until now, between COVID and now, we have seen numerous studies out there that have proven that the quality of care doesn't suffer, no matter what the platform you are using, right? Now, I do want to say that the type of disease you're managing, mostly chronic diseases and things like that, are the ones that should be managed or can be managed without loss of quality of care for patients in using this platform and using this modality of providing care. There will always be complaints and symptoms and diagnoses for which you will need to be seen in person. There's no way around that. But what technology and AI and digital health has done is made that a decision point in our care. Do I really need to see you in person for your blood pressure check? Or can you do that at home and we can monitor the trend line from a remote setting? And that has, by the way, a huge impact on the workforce, patients not needing to take time off of work. It has a huge impact on climate change, not having to drive back and forth to your appointments and taking time off. It has a huge economic impact from a patient standpoint, where they don't have to look for parking, pay for parking meters. This is all US centric, of course. But so there's a lot of ups to this without sacrificing the quality of care that we can deliver. And I think there's more to come. I think this landscape is still evolving. We've gotten a taste of the forbidden fruit, if you will, during COVID. And now I think it's going to expand and grow, because we're going to have more studies that come out to prove that the quality of care, the value of care is there using these platforms.
So Dipu has covered the entire spectrum of digital health ecosystem, and I know that it's a passion, and that's what she keeps on speaking about in most places. And it's wonderful to hear from her on that. Just a couple of introspects from my side. How do you see artificial intelligence augmenting the DH ecosystem? I think it's mainly through AR, VR, and the chatbots. I think these are the three segments from the patient's perspective or the user's perspective that you see. And that's there, and you can have it applied with your digital health ecosystem. But biggest challenge to any successful DH ecosystem, or even the use of AI, are two things. One is the availability of a structured data. This is going to be the driving force in the success of a DH ecosystem. If you're dried out of data, then your DH ecosystem will not work. So the data has to be thoroughly available, continuously available, and at the same time, it has to be structured without any gaps. That is going to be a key rule, key point in having a successful digital health ecosystem. The second most important thing, and I think this is where technologists, clinicians, software developers, AI developers need to work across the globe. And I hope folks listening to this would take some important takeaways from this, is the need for integrated data interoperability. If that is not there, then no digital health ecosystem will exist. Rather, it will thrive for a while, and then it's going to kind of become completely vestigial. So I think these are the two very important points which needs to be worked on in the year 2024 and maybe even in 2025. Getting structured data so that whatever you're building on, your large language model, your digital health ecosystem, it continues to thrive on that data. And I think a country like India, I think people can say about the USA, which would be a little better placed on in terms of data. In India, we at the moment are kind of running short of structured data, because to get structured data, you need to have good electronic medical record data, and that is lacking. That is lacking in most parts of our country, and that's where the government and most of us clinicians, technocrat clinicians, need to start working on that, so that we have structured data. From that structured data, a structured algorithm is going to come, and then comes the question of data interoperability. So a good LLM, which is good for one use case, or a good digital health tool, which is good for one use case, will be interoperable to another one, which is probably applicable to another use case. And that's where the complementary digital health ecosystem is going to go. So these are the two things that we need to look out for in 2024 and 2025.
Right. I would agree with you. And from a US perspective, when it comes to data, we have a lot of data. It may be structured, but it's not labeled. And I think that is the challenge, I think, for the US part of it. While we have EHRs and we have the data, it can be extracted. It's not labeled for use. And I will say that in 2024, everyone needs to learn love their data scientists, because it really is going to be, data scientists are going to start becoming part of clinical teams for good reason, because they're the ones who are going to help you really make those decisions for patient outcome and patient care. And I completely agree that data is going to be the thing that the driving force for what we can do and can apply in real time for our patients. So agreed.
Yeah, fascinating insights, Dr. Amit and Dipu. Now, moving ahead, ensuring global healthcare accessibility is a noble goal. So, Dr. Amit and Dipu, do you see AI technology making significant strides in this area? Could you share some notable examples of how it's promoting equity in healthcare?
Go ahead, Amit.
All right. I think we got to understand and take each step as it comes. While we should not get overthrown with this fascinating technology of AI, we should also understand the potential that it brings in making healthcare more accessible, affordable, and equitable, especially from the context of a country like India or even other parts of Southeast Asia, if I talk about. But starting today, January 2024, if we start thinking about AI making healthcare affordable, equitable, and accessible, I think we are putting ourselves way ahead of times. I think we should let AI develop. We should understand the potential that it brings, because with the potential, the good that it brings, a lot of limitations will also come. And we should decide the potential of an AI tool or a language model, a small or a medium language model, or any particular algorithm based on its regional potential. But yes, the big goal, the long term goal, and I would say that would be the skyline goal, is that if technology can make healthcare equitable across the globe, I think that would be a fascinating thing to achieve. But for that to happen, a lot more things need to happen before that. And the first thing that needs to happen is AI literacy amongst clinicians, amongst users, and not just amongst, when I say users, I don't only mean the technocrat clinicians or the doctors and the researcher, but also among the end users, the patients,
Yeah.
the general public. Because if you're using a tool and you're not aware of its plus and the minus, then you are bound to get misled. So once that happens, once we have a good AI literacy happening, a good acceptance of AI tools across all domains, we can have guidelines and regulations that can probably make equitable healthcare more possible in the years to come. But standing today, if you ask me this question, Harshita, I would say that can be a 5 year goal or maybe a decade goal, a 10 years goal, not in the near future. The next 2 years, we are focusing more on understanding it, taking care of the limitations, and more importantly, using AI effectively and ethically. Then comes the
I would
question of using it economically.
Yeah, I would
So
I
the
would
three is,
completely agree. Yeah, I would agree with
yeah,
that. I think we're not there yet. And of course that's the ultimate goal, right? For
yes.
equity, access, all of that to be part of the care that we deliver. And what you don't want to do is end up applying an algorithm that is imperfect, that we don't know how it functions and how it works to a population, to perhaps some of our most vulnerable populations. And we really need to be very thoughtful in how we apply these models to, and I will say accessibility to the pediatric population, the geriatric populations. Those are populations that tend to be very vulnerable to a lot of these tools. And so we definitely have a long way to go. And this is an ongoing conversation, much like ethics and bias are going to continue to be in the forefront. This is going to be one of them. The ultimate goal is, of course, to increase accessibility and equality and equity, right? Equality, equity are all part of that equation. So more to come. That's not to say, though, we are seeing the development of some AI tools in the realm of robotics and that are helping patients see for the first time because they're able to kind of use sensors to allow for that. We are seeing the use of technology and these robotics in the sense of Parkinson's disease to help with tremor reduction. So there is progress being made, but we're still in the very, very early phases of this.
Yeah, appreciate your thoughts, Dr. Amit and Deepu. Now shifting gears to implementation. What are the main challenges healthcare institutions face when integrating AI in their existing systems? And how have these challenges been addressed?
So I'm going to go back to our previous answer. I think Amit will agree it's data. Lack thereof, unstructured, unlabeled, whatever version of that is, and then lack of interoperability and compatibility across platforms. That really is the foundation of a lot of these implementation issues that we end up seeing, and it is the thing that tends to slow the process down the most. If you don't have good quality, high quality, structured data with a specific goal in mind, and you can go back and listen to our podcast with Bob and David who talk about data and how important it is. I think it was episode 8, if I'm not mistaken. It really is important and foundational to every layer that comes above the data piece of it. I'll stop there and I'll let Amit share, and then we can go from there.
So the first challenge is the literacy. And when you talk about the literacy, it's the literacy amongst the healthcare administrators, the healthcare providers, the doctors, the nurses. Because it all starts there, what AI tool to use, how to implement it, and where to start from. And I think this is a question that I keep getting from most, hospital entrepreneurs that, if I want to implement some AI tool into my practice that is going to make it easier, where do I start from? How do I identify the need? And where do I start from developing something that is very specific to my need? So I think that is where the challenge at the moment is coming, is that most people do not have a clear-cut understanding about the functionality, about how this goes. The second most challenge that you would probably see is a good, successful collaboration between the stakeholders of the healthcare industry and the stakeholders of I would say, the data industry or the technology industry. And I think this collaboration is very much needed in 2024. Maybe a one-to-one collaboration, maybe a one-to-many collaboration, but that's where it's all going to start, where you start shaking hands with your technology counterparts or with your healthcare stakeholder counterparts, and you start working on regional projects, which is very specific to your need, to your use case. You start generating funds for it. You start understanding that investing into that is going to probably bring you more financial or business revenue in the days to come. Because you see, healthcare is either driven by the government, which is a public health, and the otherwise it's private, which is driven by business. So if you look at private health, if it's not financially viable, nobody would be interested to invest into AI, no matter how sci-fi fascinating it looks. So I think these are the questions which needs to be answered today by the stakeholders of healthcare, and thereby you can have some some integrations coming in. And if you ask me, in a wild way, like where to start from, I would say start using simple machine learning tools for the best use case applications. Because in 2022, when we launched into generative AI, we kind of thought that machine learning and deep learning is like of the prehistoric era. Well, it's not that, it's still there. And it still has fantastic use cases. And if I can exaggerate a bit and I say that if you have use of the generative adversarial networks on some of these pattern recognition or deep learning models, then you're going to get much more better sensitive outputs that you used to get in 2020 or 2021. So you start using those, early on, start gathering your data, start understanding what your data needs and where the analytics needs to come. And most of the predictive analytics, and I think we will be talking a little about predictive analytics, most of the predictive analytics can be solved using machine learning and deep learning algorithm tools. Some of the logistic regressions that Bob and David keep talking about, and they've spoken about in our previous podcast that Deepu was referring to. And then it comes more using it with a better user acceptability. And that's where your natural language processing comes. That's where your generative AI comes. And you want to fine tune it using it super added with a larger language model. So you start with the basics and then you start jumping into an LLM or a small language model or a medium language model because it all sounds fascinating to use. Because most people ask me that how I can start implementing chat gpt into my practice. You can do a lot with chat gpt into your practice, but use the simple use case, the simple use tools, like for example, create a gpt builder that can just convert a speech conversation between you and your patient into a text. And then you have a gpt builder, something that we developed, that you have this gpt builder just convert that text conversation that you had with your patient, categorize it into symptoms, complaints, observations, discussions, consents. And that would make your practice a little bit more easy. Use it on 10 patients, use it on 15 patients, 20 patients, 100 patients. If you feel that is going good, you can start talking to some developer or some technology friend who can help you build a good algorithm out of it, maybe based on an open source LLM, or even create an API integration with ChatGPT itself. So that's where you start. That's how you start. You develop your particular need, then you develop your use case, and you start applying that into the larger practice.
So I'm smiling because one of the things I teach is quality improvement science at Pitt, and what you have just explained is exactly what we talk about, which is identify your aim and your goal, and then try it out, really plan out what you want to do, then engage your stakeholders, and then go from there. Right. And so it really is going back to quote unquote old school science, right?
Absolutely.
Quality improvement science is right the crux of a lot of things that we do in healthcare. And so those models actually still apply in the context of these tools that we're trying to develop and use in our daily practices. So an excellent example of, how do we really bridge the connection between I have this amazing idea to how do I implement it in my daily practice?
Yeah, and how have patients and healthcare professionals' attitude towards AI in healthcare evolved? Are there noticeable trends in acceptance or resistance?
So I can start there. I think there's resistance among healthcare providers and probably too easy of an acceptance from patients. It's been a little bit of a reverse reaction, I think. So patients, and I think partly this has been driven by the pandemic and telemedicine and remote patient monitoring that has been implemented early during the pandemic. And because it has become accessible and the use has been fairly easy for patients in terms of adoption of these tools, the patients are starting to use it more and more. Dr. ChatGPT is being replaced by Dr. Google more and more in our daily lives. And so I think patients are very excited and want to adopt it. Healthcare providers are, I think, appropriately wary and risk averse because of all of the medical legal aspects of it and the regulatory aspects of it that we are still kind of grappling with, that we've talked about previously. And so I think we definitely need to find that healthy balance about where can we use it and where can we not use it, and really, again, going back to Amit's point about literacy, educating ourselves, educating our patients so that there's not a propagation of misinformation and disinformation around medical topics, around healthcare. So I think patients are excited. I think healthcare providers are excited, but they're a little bit more wary and risk averse when it comes to this. And I think that's an appropriate and healthy attitude to take with any new piece of technology. I can imagine what it was when the first CT was used or the first MRI was used. It's another piece of technology that we definitely need to say, okay, this is a tool. What are we doing with it? Where can we apply it?
So from where I come from, I think doctors, healthcare providers are curious, very, very curious to know what's happening, how it's happening. I'm really glad that is there. For patients, they're still fascinated like they would be with a Star Trek movie. So I think it's going to take a little more time for doctors to kind of understand, doctors, I mean healthcare providers, to kind of understand how this is going, where this is going, what's their role into it, and how much of would be actually taken care by the AI tool and how much of it they would play a very active role. And the dissemination into the patient population would largely depend upon the user interface. And I always keep saying this to my technology friends that the success of any technology tool to the end user depends upon how easy the user interface is. If your user interface is cluttered, if it's not a good thing to view at, you won't get much engagement. If your user interface is easy, a very simple to use, like WhatsApp or like a chat GPT, web page, you would find more acceptability coming in. And I think that's how it would be into the larger population. But again, the guidelines will have to be set very accurately when these models are being put to use for use by the general public. Having said that, there's a point I would like to raise here because we know we have a lot of viewers who are from the technology backgrounds. A lot of AI models and tools are being developed by our technology friends, which are being thought would probably address certain need gaps. But when you put that into practical use, it's not probably addressing the need gap. Rather, putting a very risky tool in the hands of a patient who might not be that well educated to operate it and use the interpretation of the model to the best of its understanding. So that's what I say, that whenever you're developing an AI tool, it is best you collaborate with a healthcare provider who understands the ground zero situation of the need gap. And from that need gap, you create the model. And then you are justifying to how much of the access you're giving it to the patient so that while it is used for the best possible case, it is not misused and it doesn't pass on any misinformation to the patient. 2024 and 2025 will be very crucial for these points between healthcare provider and the patient. And trust me, it will also go a long way in building a healthcare provider and patient relationship. Because if you have them connected with technology and AI, the relationship may go in either way. It may worsen or it may even go from worse to better.
Yeah, I would just want to re-echo what Amit is saying about having a clinician or a healthcare provider on your team if you're building a product, because you may have the best product, but if it cannot go to market in a safe manner for patient use, you're not going to have any ability to kind of market it to healthcare providers in any way, shape, or form.
Yes.
Great. Now shifting our focus to predictive analytics. How has AI been utilized in this realm within healthcare, and what impact has it had on preventive medicine and early diagnosis?
So I'm going to start with that.
Yeah,
Okay.
you start, Amit.
I would love to speak on this point. The whole realm of medical research will change with the influence of artificial intelligence. The level of evidence, and this is something which I strongly echo, and I have said that in many platforms, the level of evidence that we grade with clinical trials, and then with the meta-analysis, and then with the real-world evidences, and then with the case reports, the way you kind of stagger them, I think the whole strength of the level of evidences would change. Because data being the new oil or being the most prime thing which would drive any AI algorithm would be the prime fuel. And the way a research is conducted from top downwards would probably be now from bottom upwards. So while you have a particular product and then you develop a trial and then you apply it and then you see how it is being used in the real world, would probably be the other way around, that you have the data and the data will tell you what kind of product you need. And that would create the need gap. And that's based on that, you will be developing your particular product. You talk it about a pharmaceutical product or any therapeutic tool for that matter. So the fundamentals on which clinical research or medical research is driven will change if you keep data and AI at its pivots. And I think that is where predictive analytics are going to play a big role, because you're going to be predicting a lot of things from the data that you have, which earlier you could not predict or a human could not predict. And you would have the AI tools picking up those patterns and those nuances, which probably a human mind earlier would not have been able to pick up that pattern. And that's where the need of the research question, and then the format of the research would probably be driven in a completely different way. And I would really, really love to see this change come, because it would be eventually a need-driven approach. And a need-driven approach will definitely bring you a much more realistic and a much more better outcomes in the domain of medical science. Dipu.
Yeah. Yeah, I'm gonna let, I mean, I think that is amazing. And I think I completely agree with what you're saying. And a couple of examples that we as a society, as a healthcare profession, have struggled with, and where predictive analytics can really help make a dent, are in various neurological and degenerative disorders such as Alzheimer's and Parkinson's and all of these disorders. And imagine if we could use predictive analytics to say, this is the risk of you developing XYZ disorder 30, 40 years before you develop it, and then using our knowledge to, or the current tools we have and the tools in development to help mitigate the onset of that disease or to a later stage. And these are just a couple of examples, but I think the same could be applied in the context of all the chronic diseases that we see on a daily basis, from hypertension to diabetes, right? If I could tell you, or if Amit could tell you in his clinic that, you know, your chances of getting diabetes in 15 years are XYZ, here are the things that you can do now to change that 15 years to 25 years. That's an amazing piece of information and literacy that you can really educate the patient on in terms of lifestyle changes that will then, by the way, have a ripple effect on the whole healthcare economy and how we improve the outcomes on a long-term basis, but also decrease the economic burden to the patient, to the provider, to the country as a whole, and the system as a whole. So I'll leave it at that. But I think this is the area where I think data and literacy and predictive, all of these things are going to really align well for us, hopefully, in the near future.
I'm just going to add one more point to what Dipu said, and before we go on to the last question, that, you know, in the segment of chronic diseases, the outcome of the disease largely depends upon the behavioral modification of the individual.
Yeah.
And if some of you would know, there is a concept called the nudge theory. What is the nudge theory? It tells that if you nudge the patient with the right information at the right point of time, then you're bringing the right modification or the right adaptability in the lifestyle or in the practices of the patient or the individual towards a better clinical outcome. And if you look at all the guidelines, you know, that is there to treat a chronic metabolic disease, be it diabetes, hypertension, and then you look at the practice trends, you will see there is a large gap. So from evidence to practice, there is this big gap. And this gap is mainly because of a behavioral resistance that just not comes, or I would call it a behavioral inertia, that just not comes from the end user, the patient, but also to some extent from the other stakeholders of healthcare, including the healthcare provider. So if you can nudge the right person with the right analytics at the right point of time, you can bring that behavioral modification, and that's how it would make an impact in the outcome. And this will be possible with the help of AI, with the help of the digital health ecosystem, because you're tapping into the patient's cognitive function or to the healthcare provider's cognitive function with the right information at the right point of time.
Yeah, and now moving ahead, the last question, considering the current trajectory, what can we expect from the future of AI in healthcare in the coming years? Could you shed light on emerging technologies or trends we should be keeping an eye on?
Amit, you want to
Dipu.
take that?
No, you
Oh,
go
okay.
first.
All right. So I think in the coming years, that we've talked a lot about what was going to happen this year and next year, but I think the trajectory is we're definitely very much on the upswing of this technology. And I think some of the trends that we're going to see is increased adoption of AI tools within practices across the board. Definitely a much more robust conversation about data and how to harness and leverage data for whether it be predictive analytics or interoperability or digital literacy. I think we're going to see a lot of focus on that. And I think we're going to see more and more wearables and other wearable tech be involved in the daily lives that we're seeing. We've already seen it in the context of diabetes and various other forms of wearables, such as the watch and whatnot. I think we're going to see more and more of those kinds of things kind of come to fruition. The one thing I would keep an eye on is, although we like to look for a one-size-fits-all solution, I think we're not going to see that as much. I think because the focus is going to be more towards personalized, individualized, and precision level of care. So what we thought in terms of saying, here's a study of 2,000 people who had high blood pressure, and this is what we found, we're going to start seeing, here's a study of 100 people who are your age, your race, your ethnicity, your culture, your whatever, and here is the best thing for you based on that. So I think we're going to see, a honing in of devices and viewpoints and trials and data in order to leverage outcomes for patients.
Okay, so the year 2024 would probably see a good amount of development in the larger language models. And if I talk about the language models, I would also say about the smaller and the medium language models. It doesn't always have to be built on a larger data set. What I would really want to see is more medicine specific language models coming in, healthcare specific language models. I think that is something which is quite lacking at the moment. We do have MedPalm 2, but still doesn't have an open access. And there are some open source models being built on, like the Llama 2 and MedLM. And I think still more refinement and more use case applications of these models need to come on. That's one very important aspect that will kind of determine the future of larger language models or of these generative AI tools in the domain of healthcare. The second thing which I would really feel would be happening sooner than later would be the integration of generative AI and natural language processing in most of the wearables. So your smartwatches will talk to you, your smartphones will talk to you, and it will give you predictive analytics, and it might even have a virtual nurse or a virtual chatbot kind of giving you your healthcare data and some recommendations as to what you need to do based on the healthcare data that comes. Again, it goes to that nudge theory. With the right behavioral sort of instructions coming in, you would probably do better. So these are the two things which I would really feel that would make a change in the way healthcare domain would function. And with the development of the larger language models, with the more refinement coming in, you could finally see more and more of these LLMs making use into clinical decision support system. We keep talking about this, but please use it very, very judiciously. If you're using a chat GPT, yes, if no, people start exploring it. So if you're using a chat GPT to assist you, or any language model for that matter, to assist you in your clinical decision support as a support tool, please remember it is not a medicine or healthcare specific LLM. It has been trained on a large and a larger set of data. It does very well. I must say it does very well, but it is not specific for healthcare. So you have to use the outputs that keep coming out of it in a very judicious way and not take it at the face value. The last important development I would really want to see, and I'm sure that is going to happen with AI, is a paradigm change in medical education. The way medicine is perceived, the way medicine is taught, the way we look at our provisionals and then our differentials, and we teach our students and our youngsters to sort of adapt how you would reach to a clinical diagnosis. The whole paradigm is going to change with the use of this clinical decision support system, with this predictive analytics coming in. So the way medicine is taught will also have to evolve. If you're using an LLM in your practice, you cannot go by the textbook learning of medicine. It won't come at par. So the way medicine is taught, the way medicine is practiced will eventually see a change. But we got to go slow. That's also very important. We should not get overthrown with all these fascinations. We should got to go slow. And at every point of time, there has to be a human checkpoint. That is very, very important to the success of any AI tool. If there is no human checkpoint and you let too much of automation happen, you will definitely end up in automation bias. So there has to be a human checkpoint at every point. And above all, AI literacy is the key amongst clinicians and healthcare providers that is going to drive this.
I will just echo that last point, Amit. You gave me a great segue for this is the space I'm in. I'm in medical education, and it is truly changing how we approach medical education. And it's this space that I think needs to be impacted and addressed and adopted so that when these students graduate, they are ready to use these tools appropriately, or at least ask the appropriate questions upon graduation so that they know how to use them in a human manner, I guess. And I'll leave it at that.
Yes. Ashita.
Yeah, thank you, Dr. Amit and Dr. Dipu, for sharing your perspectives on the future of AI in healthcare. The emerging technologies and trends you have highlighted give us much to anticipate. And there you have it, everyone. Another enlightening episode of MedAI in healthcare. A special thanks to both of our esteemed guests, Dr. Amit and Dr. Dipu, for sharing their expertise and insights with us today. As we wrap up, I want to express my gratitude to our listeners. Your engagement and curiosity drive the success of this series. Remember, the journey of AI in healthcare is ongoing and the possibilities seem limitless. Stay informed and stay inspired. Wishing you all a healthy and technologically empowered future. Thank you. Goodbye.